is after that, number one, I realized that in those environments, I didn't have a safe space. I didn't feel like there was a safe space to even talk to my program director, my chair, my attendings about what I was actually experiencing. And it doesn't mean that they may have listened to it. I told them, but I didn't feel like it was a safe space to even bring that up. And I wanted to be in a place where not only do I help create safe spaces so that people can have these conversations and get the support that they need, but also advocating so that a diverse group of people, including people from the African diaspora, can actually access and get mental health care. So I'm here today to help you so we can all work together to help people be able to access the care they need in a way that is culturally appropriate. So when I look at things, I look at this equation: awareness plus action equals peace. And the other thing on the equal sign I would also put is, it can also add some happiness, increase your quality of life. So you're here, so we're going to work on the awareness, and what are some tips to give you some actions. So some of the challenges so many are facing is that our country itself has this long history of racism, and a lot of this racism is deeply embedded into our culture in a way that a lot of people may not see or recognize it. We're also dealing with the fact that we're looking at making all these changes and advocating in the context of a pandemic. So people are already being pushed and pulled in so many ways due to COVID. And the next is, all of you know, because you're on this call, that the system of accessing care and actually having the appropriate resources available is extremely creative and a little bit twisted for mental health. But we are up to this challenge. So there are some common myths. So I know for a lot of people I know, the common myth is everyone thinks a psychiatrist looks one way. And you all can probably guess what that way is. Most people think the average psychiatrist would be an old white man. So a lot of times they don't realize that psychiatrists can look a lot of different ways. They think that people that treat mental health are maybe also be crazy, or that, this is something that just rich white people do, or all kinds of different things. And there are just so many myths that can get in the way of people accessing what they really need. And I put this picture in here just so you can see it. I don't know how many of you have seen a lot of Black psychiatrists in one space. We do exist. I used to be president of Global Health Psychiatry. It was one of our book launches. But everyone in this picture is a Black psychiatrist. And what I'd like to do is help us increase our awareness and increase the infrastructure so there's a point where everyone is reflected in the continuum of people that deliver care and also set policy. So who is ready to learn? I hope all of you are, because I'm ready for us to get this show on the road. So let's go ahead and start with, we're going to talk a little bit about diversity in those who need mental health assistance. So as we all know, this country is diverse, and mental health is something, it's unfortunately, part of a lot of people's human experience. So there's no one that is immune, no group that is immune to mental health issues. And there are so many things that get rolled into that, especially because so many communities, and the communities themselves, they may not have a full understanding of mental health, but also in the communities of caregivers, they may not fully understand those communities. And one example I give of why it's important for all of us to understand these contexts is it affects how, if people even seek care, how they receive their care. So an example is I had a patient last week who was upset, feeling like he wasn't getting the medicine he wanted. For some reason, he had been getting this medicine he'd been on about a year ago. And he was mad. He was so mad. And the patient was African American, had a lot of distrust towards that system. And if you didn't have enough empathy and pause long enough to wade through his anger and where his anger was coming from, you wouldn't have actually been able to serve him. Luckily, I was able to calmly kind of hold him a little bit so that we could get to what his actual issue was, so I could solve it for him. But if you start emotionally reacting to people, it gets difficult. And one of the reasons that's a very important point is there are a lot of communication gaps that happen within the setting of cultural delivery of mental health services, where it happens especially for people in the Latinx community, but it can also happen in the Black community and other communities where the caregivers or the people in the systems don't quite understand what the person that needs help is actually even saying or what they need. And due to that miscommunication, either services aren't delivered or someone gets the wrong services or the wrong diagnosis. And even it's been shown for the Black community, it's very common for people to not necessarily get evidence-based care. People will misdiagnose people because they don't understand what they're really trying to say. There may also be some language barriers, especially dealing with the Latinx community. In the Black community, only 1 in 3 people that need mental health services get it. And then also, if you switch over to the Latinx community, 1 in 10 people in their community get services from a general medical provider and don't necessarily get services from a mental health provider. Only 1 in 20 do. The other things that you look at in these communities is that, unfortunately, especially for the Black community and the Latinx community, due to the system of incarceration, the school to prison pipeline, all of that stuff, is that unfortunately a lot of our people are receiving their care in the judicial system instead of in the traditional mental health system. There's also things where Black people may be more common to get their services in the ER versus in a clinic, but there are just so many different layers that there is a huge diversity in the people that actually need mental health assistance. And that's not just because saying that people that are diverse are all sick. When we look at the whole continuum of care, sometimes people just need a little bit of assistance and then they're good. Well, if you're in a community that either has a lot of mistrust towards the system, doesn't know how to access the system, because I know all of you all know it's really complicated figuring out how to access us, or a community that never feels heard or feels like someone's just going to drug them up or lie, then they're not going to necessarily engage in treatment. And the honest to goodness thing is that just as communities are diverse, the people that are going to need our services are going to be diverse. The people that are going to need this help to be able to function at their highest level are diverse. And as we know, with a lot of mental health issues, that especially with like depression and bipolar and schizophrenia, the longer people spend in episodes and the more episodes they have, the more likely they are to have episodes. So getting that early treatment early makes a huge difference for them and their community. So you might wonder, well, even if you get them there, does it matter about the diversity of mental health providers? And the actual honest answer is yes, it does matter. There have been studies that show that with people in the African American community, they may be more likely to follow the recommendations of an African American provider. Also, there are times where there are things that are going on culturally that people may understand a little bit better if they're more culturally aware. In addition, that there are times where the person that is seeking services may feel more comfortable being vulnerable, which will allow them to get more out of their care with someone that looks like them. And then you also see things where people need to be able to comfortably talk to someone and someone actually hear what they're saying. And if you have someone that's not a culturally competent provider giving care, they may not understand what someone is telling them, which could lead to a misdiagnosis or the wrong care being provided. And that can be a huge thing. And also, for a lot of people, getting mental health care is scary. So since it's scary, if someone has a negative experience when they try to get help, they may be less likely to get help in the future. And a lot of these communities, everyone talks to each other. So if you have grandma or big mama and big mama's like, well, you don't do that. You shouldn't go see these people. These people act crazy. These people don't act right. They're not going to listen to you. They're just going to drug you up. Then you're most likely not going to come. So it's important that we have a diversity of the people that are providing care, and also the people that are in the administrative positions in these clinics and facilities advocates and also in areas of legislation so that we're able to actually deliver culturally competent care and have the right resources for everyone's communities. So that switches us over. So we know we have these diverse populations. We know that we need diverse people to help make a richer experience to care for everyone. Is that now we're also dealing with this uptick of racial injustice. And this is causing its own set of stress because for a lot of people, they may not have realized so much was going on until it's gotten more media coverage. That there are some folks that really didn't think this there was so much racism, that people were just getting killed because of the color of their skin or getting just locked up, that are now becoming aware that this isn't something that different diverse populations have made up. It's real. And the fact is right now the light is probably being shown a little bit brighter on Black lives. But I want to acknowledge that we're not the only population that is struggling with racial injustice. I mean, you have Latinx populations that are locked up and getting deported and separated from their children. There's just all kinds of stuff going on. And this current amount of racial injustice, number one, it causes a high level of stress and it's causing anxiety. And in the context of the fact that people are emotionally worn out from the pandemic itself, is that it's shifting a place where a lot of people don't have the emotional reserve to manage the racial injustice that's going on, that it's affecting them more. So especially if you look at some people in the Black community that were able to kind of put on a mask and go out into the environment, do their jobs and do everything, that now with that less emotional reserve, people are being emotionally affected in spaces where you may not have seen it if you weren't intimately connected to them or really close to them in an interpersonal relationship. You may not have seen it. And now it's bleeding over. And also this amount of racial injustice is also causing some emotional unease for people that may not be the target group that's having this injustice, because it is just so strong and uncomfortable. So people that are potential allies or allies are feeling really emotionally unsettled. And the important thing to keep in mind with all of this is, number one, it's pushing some people towards change. Some people, it's pushing them to continue to be racist and ridiculous. But the thing is being able to be culturally competent enough to realize that this is affecting people and to be able to ask people about it. If you are an actual, mental health care provider, it's important to be able to ask these questions, to ask people if they're affected by the racial injustice that's going on, because sometimes people may not volunteer it and it may be something that is causing a significant amount of distress, and we want to make sure that we're able to treat and assist the whole person. So you have to have an idea of what's really going on with them. So there is this poem. It's first they came for the socialist and I did not speak out because I was not a socialist. Then they came for the trade unionists and I did not speak out because I was not a trade unionist. Then they came for the Jews and I did not speak out because I was not a Jew. Then they came for me and there was no one left to speak for me. And I think the reason I put this in here, it's not, I think, I know, is because we're in a time where there are things going on that are injustices against so many people. And at some point, we have a crisis of empathy because it's going to take that empathy to be able to assist all of us. And you have to be willing to stand for people when it's uncomfortable in all kinds of spaces, and not just sit and be comfortable in your privilege or in our privilege. Because most of us have some type of privilege. So the next thing is what do we do? And I'd say we're in transition into a brief segment about action and allyship, because it's important that all of us need to act as advocates. We're acting as advocates for ourselves if we're getting treatment. We're advocating for our family members and our loved ones if they need something. We're advocating for the community. There's just such a huge role of advocacy. And the important thing about a lot of this action, when you look at action and allyship, is being willing to take action when it's not comfortable. It's very easy to do things when it's not really going to affect you. It's you don't have a lot at stake. But being an ally and a true advocate is when you step up to do these things when it's uncomfortable, when the people that are affected aren't in the room, when you speak when it's uncomfortable, when you move through these spaces and have your eyes wide open and are invested in the health and wellness and the ability for everyone to live a life that is actually legitimately free in this country, even when it's not comfortable. And the other thing that's about it is being able to be open to learning. No one gets all of this stuff right all the time. So being open to if there's an issue or a question, or if there's something that could have been done a little differently and you receive feedback, being open to it is not a judgment on yourself or your character. We all have to learn. So being open to feedback so that we can all be the best allies. Because even though I'm African American, I can still be an ally to other communities. So it's important for us to be empathic to so many people because everyone needs this. And at the end, it's going to make us better because, as you all know, and I'm sure you all talk about so much, is that when people have mental health issues, people don't function well in the community. So you're not functioning well at work, you're not functioning well with your family, and there can be significant consequences to the mental health of your family, to the ability to earn money, to the ability for businesses to work. So it actually helps all of us when everyone is healthy. So you might say, what to do? So we started talking about it from the end of it's going to be very important that everyone be open to change. And to me, that's one of the biggest things is being open to change and open to learning, because all of this is still in a process of developing. The next is being open to listening. It's important to be able to have these conversations and then have these conversations in other spaces around how can we serve all of these different populations? How can we serve these? They keep changing the name. Sometimes they're minorities, sometimes they're BIPOC, but it's how do we serve all these communities in a way that is with grace, dignity, and is effective. Because it's one thing to say, we know there are Black people, we know there are Latinx people, we know there are Asian people, we know there are Pacific Islanders, we know there are Native Americans, we know there are LGBTQ. It's another thing to serve with empathy and positive intention and to really listen to people and to be open and to be willing to make innovative solutions. So one of the other things is NAMI is steeped in advocacy. So one of the hugest things is being able to not only educate yourself, but to help educate the community about what mental health is and what mental health treatment is, because since there are a lot of the myths and the stigma are because of a lot of misinformation. But it makes a huge difference when you're bringing this education to people and your heart is open and people can feel if you have good intentions and if you care. And when you do it with a caring heart, then a lot of times people are more open to learn or to try. And I think it's huge to destigmatize things so people can feel like they can at least try it out. But the other is continuing to all work together so that the systems of how to enter mental health care treatment isn't such a mystery that if someone needs it, they can't figure out how to get help. Because I don't know about you all, I get called all the time. I feel like I'm a referral switchboard because people can't figure it out. So I get messages all the time like, hey, Dr. Ericka, where is the psychiatrist in this city? Where is the psychiatrist in this city? And I'm hoping that eventually we get to the point where it's not only available for people that know somebody, but I think it's very important for us all to be advocates all the time. And the other thing is it's important to take care of yourself so you have the emotional energy to be the best you and to be centered enough that you can be that light, that you can advocate for people, that you can if you're a caregiver, provide that type of care that you need to give, that's empathic and open and evidence-based. But you need to take care of yourself well enough so you can do it and be open to learning all the time so that you can provide culturally appropriate care. So the next thing is you already have a win today. You have a win because you're here and you're open to learning, you're open to doing things differently. So I want you to pat yourself on the back for showing up and for hanging in here with me while we talk about these things, because it's not always easy, because what we're seeing going on right now is there is a legitimate crisis. There are people that are hurting. Quite honestly, we are hurting. And it's so important that we keep this in mind and are open to it so that in the future, hopefully we aren't hurting as much. And so are the people that we're serving, that they are not in as much pain. And just keeping in mind, it's important to celebrate the wins, that you can have multiple emotions at one time. So you can be frustrated, mad, angry, sad, and anxious, and still realize you did something positive all at the same time. Emotions are not mutually exclusive. Even look at Inside Out. They had multiple emotions in that little head. So I just want to also say that it's important to acknowledge the wins, acknowledge when you connect with someone, acknowledge when you realize you learned something else that can help you connect better, when you feel like you've found a way that you can speak to a community to help empower them to get the help they need, when you realize that you're able to initiate a system in an agency or an organization that's going to be able to allow people to get better care. You need to celebrate all the wins along the way. So my parting words are, one of my favorite movies are Finding Nemo and Finding Dory. And especially in this battle to actually have true diversity for mental health and to prioritize making sure that we give the best care possible and everyone has access to care that is culturally appropriate, empathic, caring, and multifunctional and disciplinary, is that just keep swimming, just keep swimming, just keep swimming. It's important to just keep moving forward. And it's okay if it's not a strong forward, it's a baby forward, that if we all keep moving forward, it's going to make a humongous difference. And since you hung in there for me for so long, I appreciate it. I have a little freebie for you. There's a little website at the bottom, covidaffirmations.com. That's covidaffirmations.com. And I have some affirmations that are very specific to dealing with the stress we're dealing with in COVID, because it's compounding all of these stressors we're having. And I do realize that everything everyone is going through right now is not in a vacuum, that there's so much going on. And I wish I could talk about more about it. So if you're interested in finding out more about me or following me, I'm on social media at Dr. Ericka, DoctorEricka. My parents used all the letters, like all of them. And if you're interested in finding out more about my private practice, that's at askdrgoodwin.com. That is askdrgoodwin.com. So at this point, I'm about to stop these slides so that we can transition into Q&A.
Great. Thank you so much, Dr. Goodwin. Like Dr. Goodwin mentioned, we're going to transition into the Q&A session. If you have any questions, make sure to put them in the chat box so we can try and address as many as possible before our time expires. So I'm going to start. The first question would be, what are examples of best practices specific to African Americans? I think when treating African Americans.
Well, thank you so much. One of the examples is the fact to even use best practices with African Americans, because part of the issue we have is that treatment is very due to who comes in the door, instead of it being, it's not varied in a way that it's customized due to what someone needs. It's varied because people have their own biases and they're not providing evidence-based care. And that's been one of the problems, especially in the African American community, that people are just kind of doing something instead of things that are consistent with what the standard of care is. And you see it across multiple different groups where some are prescribed meds more, some are not even getting therapy. And what also makes it complicated is when you start looking at the different service delivery systems versus naturally, a lot of the community mental health centers, not all of them, but some of them will have more comprehensive services. So if you're in a community mental health center, ideally, now I have worked in some that their therapy arm is more group than individual. But a lot of times in those, there are companion services also that can be huge for some of these communities, especially because then you can have the outreach and the things that typically were wraparound, such as community support workers, peer support workers, therapists, and then a psychiatrist, so that there are available modalities. If someone is evaluated and determine that they need these additional supports, they're available, because a lot of times for a lot of these underserved communities, that there are people that they need other social supports in place other than just being able to come to the office.
Great. So another question people had are there any resources out there that you suggest to be a better ally and to be, a better support system for people who are experiencing racial injustice or, this kind of trauma surrounding it?
I do have some, but I don't have the links right at hand. If it's okay, if I can send them to you, Amanda, and then you send them out. Because I think that is a great question, and it's been coming up more and more. And I think a lot of us have been pleasantly touched by the amount of people that genuinely want to be allies and want to have more of this important information. And there are a couple of tips I give with it. I'm going to give Amanda some links, and it'll be some information that's very helpful that'll include books, videos, movies, a wide variety, so you can kind of pick what version of media or learning works for you. The next is being able to have open and genuine conversations with people that may not look like you. But the last point I put when it comes to that is a lot of people are emotionally on edge. And it kind of comes in waves depending on what's actually going on for the moment, is that there may be times where you approach someone to have a conversation where they just may be a little bit emotionally raw and not ready to have that conversation with you. And being okay with the fact that there are times where someone may say, I'm glad you're interested, but I'm just not ready to be able to give you all this cultural information or to tell you all about the Black experience, the Latinx experience, the LGBTQ experience at this moment, and be comfortable if someone's not ready to talk, or if they give you resources as an alternative. Because that was something that was happening a little bit earlier, where people were becoming emotionally overwhelmed when everyone would come to them, because as someone mentioned in another question, a lot of these spaces, there aren't a lot of people of color in the space. So sometimes, especially when they're work environments or those kinds of environments, that people may feel a little exhausted because there may be so many people coming to them. But the one thing is, if you are coming with a kind heart, usually even if someone is emotionally exhausted, they'll still be able to receive it.
Thank you so much. So I guess kind of jumping off of that, someone asked, and this was a common question, since the majority of mental health providers are white, what kind of training are they receiving that could be effective and culturally sensitive and competent and empathetic with their patients of color, so that they're not reaching out to, their Black colleagues or other colleagues that are people of color, and kind of re-traumatizing them or having to have them go through it? What kind of is out there? Is there anything out there? Where can that be found?
There are some modules that I believe the American Psychological Association did some too. I know the American Psychiatric Association also has some not a work group, but they have some modules and things on culturally competent care. And there have been numerous textbooks and those things that have been done on it. Along with, there have been some other work by some other organizations. But a lot of the major mental health organizations will have modules or things on it. Unfortunately, I think a lot of us believe that there's a space that it's kind of book learning and then real learning. Um, and there's a space in it for, number one, the intention of being empathic, and being open, and not just learning about these other cultures or what they are experiencing, but being open to actually having self-awareness of what everyone's biases are. Like I have the stress and trauma of being Black in America, but I do, as an example, I have the privilege of, I grew up in a 2-parent household that was comfortably middle class. My mother was a homemaker. And on the scale of color, I am lighter hue, so I do have some privilege for being lighter than darker. It's not fair. It just is what it is. And I think there's this combination of learning about cultures and what may be affecting people, but being able to honestly and genuinely accept and recognize your own privilege, because it shifts your lenses.
Great, thank you. So another question that came up was, could you speak a little on secondary vicarious trauma experienced by African American clients and providers during this time, and how you suggest maybe to address it or to some coping mechanisms?
Okay. Well, quite frankly, right now living in the United States is significantly traumatic for a lot of people. And I can definitely say it's traumatic being Black in America right now. It goes back even to how when they started to relook at ACEs and then started adding in considering racism as an additional ACE when it wasn't originally there, is that it's all of people most likely were dealing with all of this racism, these microaggressions and these macroaggressions before, but things have amped up to a point at this time where, quite frankly, people are raw, people are done. People just don't want to adult anymore. And what makes it difficult right now is that adulting didn't stop because they're killing people so much that you can't remember. It's hard to remember every single name or everyone's name who became a hashtag, because it's so many and there's somebody all the time. And the current environment, it is really traumatic, because what I'd say makes it even more traumatic is with each of these violent police deaths, there's a safe space that has been removed. So people may not always have felt safe at work, but before you might feel safe at home. Well, past when they were burning crosses in front of people's houses. But in, kind of modern times, so now Breonna Taylor was killed in her home. Home's not safe. Ahmaud Arbery was jogging his neighborhood. Jogging isn't safe. You keep looking, going to Walmart. Walmart ain't safe. There's all these places are no longer safe. And what makes it so cumulative is people have a limited emotional reserve. So for a lot of African Americans, there was this emotional reserve that you were taught to have, that you put on this mask, you put on this face, you make things happen. And not only do you have to make things happen, you have to be very cognizant of how you present them, because if you're too passionate, you're angry. If you're too passionate, you're oppositional. If you question, you're oppositional. There just isn't this space, if you get upset, you're over emotional. Depending on how you look, you're not professional if your hair isn't straight. There are all these things that people are playing mental gymnastics with, that people were successfully able to play mental gymnastics. They were not fair. The lesson most of us learned as children was life isn't fair. You don't need to have the expectation it ever be fair. It's not fair. But now it's to a point where not only is this stuff is happening, so it's so close to home that you literally feel like it could be you or anybody. You don't feel safe on the street. Then you add in the fact everyone's already tired from a pandemic, and people don't no longer have the emotional reserve to show up like everything is okay. and then deal with it at home. And I think that's what's making it so raw and so honest right now, is that people can't hold it. There's just no way to fully hold it. And I think what's going on right now is this movement of trying to figure out how to help people at least emotionally contain themselves so that we can survive, because most people still have to work if they have a job, depending on what happened with COVID. Then you still have to take care of your family. You still have all those same responsibilities. And the fact that you're overstimulated and traumatized, and then the fact that you can turn on the news or something come on social media anytime that's going to tell you someone else lost their life simply because they're Black. So it's definitely all of this secondary trauma, and it really brings up how they redefined the definition for trauma for PTSD, for more of the exposure, the secondary exposure versus the primary exposure as it was previously.
Thank you. Kind of jumping to a slightly different topic, but someone asked, since we spend so much time at work, how can we encourage our employers to advocate for more mental health help and support, especially during these COVID times?
The sadness and the beauty of what we're going on right now is that there is so much change going on right now, and a lot of businesses are not able to function in the way they were just due to the shifts with COVID, that people in general tend to be a little bit more open to conversations around mental health, performance, what people need. That I'd say one of the biggest things is figuring out if there is a safe space where you work. Do you feel safe and comfortable speaking with your supervisor or whoever would handle that kind of programming? Because right now what's going on is a lot of people are reaching back, looking at how extensive their EAP programs are, but also, and it's probably a little bit more prominent in larger organizations and smaller, just due to their resources of other avenues of stress relief that they can provide, such as like online exercise or relaxation or meditation, or access to different apps like Headspace or Calm that they may be doing through their own business. For smaller organizations, a lot of them may not have the capital to do some of those larger things. But I think the first thing is being able to be open to advocate for yourselves with your leadership around the fact that what practically is going on. And even when I've talked to different organizations and businesses, one of the things is it's the same thoughts that go on with when you ask someone if they're okay and they say I'm okay, the assumption is they're okay. And even though it's complicated, sometimes everyone has to figure out how much room and space they have to have open conversations where they work. I'd like to say every place is open and everyone isn't, so I'm not going to even go down that road and say it. But to be able to have those conversations with who you report to, or who is, your, I don't know if it's like not necessarily always a union rep, but who may be the employee rep or something like that, about what really people are dealing with as far as the stresses of the job balanced with the stresses of everything else going on, because people are now having to look at ways to be more flexible, because the ways to deliver any services have changed dramatically, from how to manage working at home, and not just working at home while people are virtual schooling and have these other responsibilities going on, how to go to work if they're having issues with childcare due to COVID. And it's just going to be important to be able to have those conversations and to start honestly thinking about what you actually need. Because what ends up happening for a lot of you look at this like a negotiation, is if you don't have the end in sight of what the goal is, what you need, and how to get there, sometimes it's hard to actually get an actual result, because it's still not going to do any good if you're stressed out, you're feeling overwhelmed, you're feeling more dysphoric or anxious, and then your boss just says, "Oh, I know you're really stressed at this time. that's not going to do anything. You actually need some action. So some of it is being able to say, is it that you need more flexible work times, or do you need some dedicated time that is downtime, or do you possibly need some additional mental health days, or is it a situation where you need an expansion of what EAP is, or an expansion of wellness resources that go beyond just seeing a therapist? Because some companies actually they have wellness coaching included, nutrition, just kind of what kind of things you need so that you can advocate for them. I think the hard thing is whenever you go into a situation and you don't actually have an ask, you you might not get what you want.
Thank you. That's very helpful. Let's see. So the next question is, are there any examples or recommendations concerning policy and procedure considerations, which you could talk about, that which organizations may consider in promoting macro level change to better create the climate which invites diverse populations to the doors of healthcare, of which many of us are stewards?
Okay. I'd say one of the first things is figuring out a way to have people from these diverse populations in the rooms with the policymakers, because that's one of the points we talked about earlier, which is one level is having your healthcare providers, like your social workers, your physicians, your psychologists, your NPs, and your PAs have some level of diversity. But at the end of the day, a lot of places, unless it's your own practice, those people are not setting the tone for the policies or the procedures for the organization, which is why it's important that we start having diversity in the people that are executives, or if it's a larger organization, in the C-suite. Because what ends up happening is that sets the tone, that sets the hiring, that sets what the culture is. So I think one of the hugest things is advocating for people to be able to have some diversity in HR, for people to actually have diversity inclusion, to have people that are not all white males sitting up making every single decision, because you don't typically get the richness that you do when other people are in the room. And there's no one, you just end up with this monolith. Because I think the other huge thing is we can all read stuff, learn stuff, but at the end of the day, you also have to keep in mind that no population is a monolith. There's not just one thing that's Black. There's not just one way Latinx looks, or one way, Asian Pacific Islanders look, or Native American. There's not just one, LGBTQ doesn't all look the same. Is being able to have that space. So I'd say the first thing is being able to advocate for the fact that you need diverse people in some of these roles, so that the policies themselves, I'd say the next thing is that there be some type of procedures that have to do with outreach and education, because you need everyone that's working for the organization to be continually getting educated to provide cultural competent care. And that's not going to be a one-off. That could even potentially sometimes be meetings or discussions, or even some group supervision. But it's important that that's not just a one-off. And then education for the communities that you are working with, so that it ends up being some type of policies and procedures that have to do with actual outreach. Because there are certain communities you're not going to get with random emails or a website. And the other thing is having websites that work. It's amazing how many organizations, clinics have websites that are horrible, that they're terrible to navigate. The people can't figure out what the services are. How do they get the services? Making sure people update addresses, because especially I've worked in a lot of community clinics, they'll move and the websites have the old addresses up. So then after they've moved, even established patients can't even figure out how to even get their care from the clinic they were getting at. And it's like some of it is super basic, but people just don't do it. But I think the community outreach is huge, because not only does it say that you're there to provide services and to help, it lets people see that you're regular people that actually care. People will seek treatment where people feel like they're going to be cared for, or people have some type of investment in them and their community.
Great, thank you so much. So we have another question that's, to what extent are Black psychiatrists on the faculties of social work programs, or I guess to what extent are the people who are teaching this next generation diverse as well?
Well, I mean, it's not always the most diverse group teaching, because we aren't even in the field to begin with. And then one of the things I've been working on, which you see quite often, is that, and I appreciate NAMI for having me here, is that you'll see a lot of outreach or education, community programs, panels done by civic organizations. And it's so often that these panels and activities never have a psychiatrist. You'll look, and it's a switch, and these people are important, because I won't lie, I was on a panel and the person that was from the National Suicide Hotline was the bomb. But I think there's a richness you get when you put the whole treatment continuum together. And it sets up a situation where the community is disconnected from what psychiatrists do, and the psychiatrists are disconnected from the community. And I think there's a necessary point of bringing everyone together, because a lot of people are scared of us. They're scared we're gonna drug them up, we're gonna dope them up, we're not gonna listen to them, and they all think we're weird, and they're like, I can't talk. They're going to be weird and crazy. And there's something about when people see us that they realize, oh, this is a regular person. Oh, I can actually talk to you. You actually can hold a regular conversation, and you're going to listen to me. So I think on that end, it's important, but it's hard. I don't have any exact numbers. I can look to see if I can get some for you. Naturally, there are places that tend to have more African Americans in some of those teaching positions, especially not necessarily for social work, but for some other things that are like, especially there are some historically Black colleges and universities that do have arms of medicine that do PAs, MDs, public health, and those kinds of things. And even I think Morehouse School of Medicine also does. They have a disparities arm that Dr. Satcher started. So some of those will have more, because they're all kind of sitting together, or whoever they companion with. And then there are certain cities that just typically have higher concentration of African Americans. So like if you're in Atlanta, people may have a skewed view of how many African American psychiatrists and therapists there are, because Atlanta is such a city that has such a concentration of African Americans, which makes it falsely seem like there are a lot of us, where you go to a lot of communities and we're just not there. So I think you bring up a huge point, but I'd have to look to see if I can find you some actual numbers.
Awesome, thank you. And we'll make sure to share anything that Dr. Goodwin sends my way with anyone who's interested in it. So I guess to kind of wrap it up, we're coming up on the end of our presentation time. How are ways that you see to really break down accessing mental health treatment and mental health in general within the Black communities? What are some ways that maybe you go about it, or you've seen other people that seem to be effective?
I'd say one of the first things is you have to get in the community. Is that when you start talking about it and be about it, you have to walk the walk. So it's, some people end up doing outreach and they do things with churches. I've done some things with churches. I have friends that have deal with barbershops and hair salons, but literally going where the people are. In this era, I know I did it quite a bit, but it's even been more now that we've been, it's been a perpetual Zoom. I think all of you are probably aware of, it's been like one Zoom after another Zoom, is a lot of these different types of presentations, being in the media, being on podcasts, as different organizations are doing panels or things about mental health, hopping on those, even being on social media, talking about mental health, all these different creative kinds of touch points, going into colleges and schools, writing books, doing articles, being some of the voices behind some of the articles, even in magazines, blogging. I have some books on Black mental health. It's literally some of all of it, but I think it's hard to increase that access if you're kind of in your own little corner doing your own little thing. And the other thing I think people also don't take stock in, as big as it is being able to, with the type of connectivity we all have, even on social media, and being in different groups and saying, hey, yeah, this is mental health, we're Black, we're here, and I think it's huge to be able to do those kinds of things. But I do strongly believe it's hard to do that outreach if all you do is sit in your office and see patients and there's nothing else going on. I think it's important for us to have robust websites, to partner with people. It's important that people know you exist. And then if you're in an agency, that you're asking your agency, what kind of things are we doing to publicize we're here? Or what kind of things can we do to assist the referrals that people come in from, like, especially when you're in community mental health, what makes the referral system smoother? Because, if someone comes into my private practice, it's me, I shoot you emails, you come in, I see you, and it's all very streamlined. But there are so many things along the way, especially when you're coming into agencies or things like that. You have multiple intakes, and someone's getting this information and this information over here, and just trying to find ways to streamline these processes so people aren't totally confused, because the processes themselves are so confusing that I think sometimes people will stop the process because it's too hard. The next thing is, people will stop seeking care because the first person wasn't a good fit. And I look at finding a mental health care provider is it's like dating. You have to find one that's going to be the right match, that you're going to feel comfortable being open to, that you feel like hears you, that has a treatment strategy that is aligned with what your values are. So the other thing I'd say is, encouraging people that if you try one person and that doesn't quite go the way you want, that doesn't mean you can't try another one.
Awesome. Well, thank you so much again, Dr. Goodwin. We're so excited to have you join us this year. Like we said, we'll be passing out any information that she gives to me so that people can access that as well. And we hope everyone has a good rest of their day.
Thanks again for having me.